Welcome to our webinar on the live care home bed state, connected care homes. This is a system that's been developed by the North of England Commissioning Support Unit and NHS England North. The webinar is going to include a brief presentation from myself, Ruth Holt, and then I'll hand over to my colleague Jonathan Maloney, who will take you through a demonstration of the system. The reasons that we were looking at this is over the last 2 years, the North of England has moved from having the lowest proportion of social care attributable delayed transfers of care to the second highest, and you can see that in the graph. NHS attributable reasons have fallen, however we're seeing increases in the number of social care attributed reasons, and now 8% of detox are jointly assigned to both NHS and social care. There are 6 main reasons. Just over half of these are due to care packages, completion of assessments, or seeking further non-acute beds. But about 37% are due to availability of nursing homes, residential home beds, or indeed patient choice. So that 37% is the 37% which we're trying to reduce through the development of this system. So why did we want a system? Well, we were trying to find a way to assist the patient flow, providing better outcomes for partners and patients. We wanted a system that would help us to reduce the length of stay, reduce delayed transfers of care, and help with timely discharge and utilisation of both residential and nursing care home beds. Concept's a very simple one. We started by talking to partners to help us to design and implement a new model. And those partners were partners within care homes, local authorities, and acute NHS trusts. Working together, we've developed what we think is a very simple system which will allow care homes to input their capacity and available bed days, position, and some simple demographics. These can then be searched by either health trusts or local authorities, and they do that using a very simple portal which Jonathan will demonstrate. Benefits are simple. It's a streamlined real-time process. It gives a reporting function, which we'll be able to show you. And we hope that it will also improve patient choice and experience by directing patients to care homes where there are beds and where there is availability to meet their needs in a timely way. So we've got a web-based portal. As I say, it's been developed by NECS in conjunction with NHS England North, and with a specific view to help minimise delayed transfers of care. By using the system, care homes can share their bed capacity by bed type and a few basic demographics with both NHS providers and local authorities. NHS providers and local authorities as commissioners of care home beds can quickly search for available care home beds by bed type and cost envelope, and we'll show you that within the demonstration. It should help facilitate rapid discharge and help patients and their families to make informed choices around beds that are available at the time at which they're doing that search. The system also contains a basic contact directory, so NHS, local authorities and care homes can be put in contact with each other in a simple way. In terms of benefits then, it's close to near real-time capacity. As soon as the care home enters the information, then that's available to view by the local authority and the NHS. It takes us away from that system which many areas use of ring rounds on a weekly basis. It's very simple to use. The feedback from care home providers has been very positive. It's intuitive, and I always say to people looking at the system, if you can book train tickets or do internet shopping, you will be very well equipped to use this system. It is very straightforward. In terms of ease of deployment, there's nothing particular needed by way of technical infrastructure. If you can get into the internet, then you'll be able to use this system. And it's accessible on a variety of different devices, such as iPads, tablets, smartphones. There's no fancy connection required. It is simply internet-based. It's secure. It's got all the necessary security associated with it, and we don't put patient identifiable information onto the system, which does help in terms of security. In terms of cost effectiveness, there's no cost to individuals using this. The costs have been covered by NHS England North, so there is no cost associated with it. And if we can use this as a standard approach, you will be able to get off some simple reporting systems that will allow you to produce a basic system of reports, which will also help with market oversight and the local authorities in their requirements to meet market oversight function. So proof of concept, we're piloting it currently in Wakefield and Manchester. The ease of system comes up consistently. People who've seen it and used it do like the ease of system, and they like the fact that there is bulk uploading of user data, so basic demographics are pre-populated for all the care homes. Key messages, however, engagement is really key. So if you want to work with this system, then it is really important to get with care homes, local authority and NHS providers and commissioners engaged from a very early stage. The system itself has the potential to be both a national and regional system. Some of the advantages and considerations are listed here, but in terms of using the system itself, if we can get this established, initially we'd like to think in the north of England, but potentially across the whole of England, then it will mean that if somebody is in a hospital bed in, for example, Liverpool, but their family live in Leeds and they're looking to be discharged to Leeds, if Leeds is on that system, then you will be able to look from Liverpool across to Leeds and identify a care home that's suitable for requirements of the patient, close to perhaps their family members, or some other postal address where they would like to live. So joining up across the whole of the north of England and ideally beyond that will be really helpful in terms of facilitating discharge.